Australian experts are urging caution after US President Donald Trump announced America's Food and Drug Administration will notify doctors that using paracetamol during pregnancy could be associated with an increased risk of their children being diagnosed with autism. A host of the Health Report on Radio National, Dr. Norman Swan, says contrary to the Trump administration's claims, there is no autism epidemic.
What's happened over the years, it's easy to understand the confusion, but this underlies the rhetoric from the Trump administration and Robert F. Jr. In terms of his attack on vaccines and so on, is that there is an epidemic. What happened, 20 or 30 years ago, to get a diagnosis of autism, you had to be a child who was intellectually disabled, who had repetitive behaviours, who couldn't speak, who was banging their head in the corner, that stereotypical stigmatised view of autism. Then there was another diagnosis called Asperger's, which was people who were supposedly milder, and was considered a separate condition. Then they realised there was a spectrum of issues to do with communication, repetitive behaviour, repetitive thinking, from that child, that seriously disabled child, through to people who had high IQs but had those communication difficulties and repetitive thinking, repetitive behaviours. And when they went to that spectrum, there was a broader, and they got rid of Asperger's and rolled that into that spectrum. There was a broader church, if you like, for diagnosis. And the causes are genetic. And so the prevalence of autism is round about 3%. In Australia, in the United States, when it's properly diagnosed and carefully diagnosed, hasn't changed that much. It's just that there are more people being diagnosed on the spectrum than 20 or 30 years ago because of the change in definition.
So what is the evidence on paracetamol in pregnancy? Because that goes to the heart of this change in advice from the Trump administration, albeit in the US.
It's messy. There are poorly conducted studies. I've just described the spectrum of disorder, which can go from really severe to mild communication issues. And when you've looked at the studies, the definition of what's wrong with the children has been loose. You're not quite sure whether, in fact, the women did take the Tylenol, the paracetamol, and what they took it for, because women are taking it for a reason. And what is known is that fever in pregnancy is not good for the unborn child, and you want to prevent fever, hence influenza immunization, hence COVID vaccine, COVID immunization. So you're trying to minimize the chances that a woman will get infected with a virus. But if she is infected, then you want to get that fever down, and paracetamol is what does it. Now, if there is a consequence, it could well be because of the fever, but the studies have not been well done. They are, and you cannot really make any conclusions. And just in the last few minutes, hours, the Therapeutic Goods Administration in Australia has confirmed that this is safe to take in pregnancy when you need it. You shouldn't be taking any drug in pregnancy unless you need it, but if you need it, take it, because you've got to be more worried about the fever than the paracetamol.